फिफ्थ प्रिंसिपल इज सपोर्ट पेशेंट मेडिकली। अब यहाँ पर क्लिनिशियन का जो रोल है वो ये होता है कि टू ऑप्टिमाइज द पेशेंट्स एबिलिटी to eliminate residual infection. How the clinician will optimize the patient's ability to eliminate residual infection is by supportive means. And these supportive means include hydration, improved nutrition, pain control, adjunctive antibiotic therapy, and blood glucose control. हमने properly patient को hydrated रखना है. We have to improve the patient's nutrition. We have to control the pain and antibiotic therapy and blood glucose control. By all of these supportive means, we will optimize the patient's ability to eliminate the residual infection. So this is the fifth principle. The sixth principle is choose and prescribe appropriate antibiotic. Now, it is clearly understood that antibiotics should always be regarded as adjunct to, not a substitution for surgical management. We have been stressing on this, that the surgery is the primary mode of treatment of odontogenic infections. So it is always it should always be clearly understood that antibiotics are regarded as adjunct to but not substitution. Okay, now three main factors should be considered when determining the appropriateness of adjunctive antibiotic use. तीन चीज़ें जो है हमने जहन में रखनी होती हैं for the proper use of antibiotic, and these are severity of infection, the second is ability to render surgical treatment, and the third is patient's host defense system. Okay, when the infection is so severe that it is extending the alveolar process, it's extending beyond the alveolar process, that means this is severe infection. In that case, we'll use adjunctive antibiotic. Similarly, if the infection जो है वो इतना ज़्यादा extended नहीं है, it is just covering the alveolar processes, it's not appropriate to use antibiotic there. Similarly, ability to render surgical treatment. Let's suppose if the patient is having trismus and he's unable to open the mouth. ठीक हो गया. Now here the situation is tough for the surgeon. Okay, इस केस में है वो patient जो है clinician will use antibiotic to reduce the trismus or the swelling, and then he will perform the surgery. And third is patient's host defense system. And the host defense system, अगर patient का जो host defense system है वो जो है वो patient जो है immunocompetent है, then it is not always prescribed to use antibiotic. Okay, and if the patient is immunocompromised, फिर आपने जो है antibiotic use करनी है. Let's now see this box. Now, appropriate use of antibiotic includes swelling extending beyond the alveolar process. Remember that. Presence of cellulitis, trismus, lymphadenopathy, fever more than 101 Fahrenheit, severe peritonitis, osteomyelitis, immunocompromised patient. In those cases, it is appropriate to use antibiotic. And let's see inappropriate use of antibiotics. Patient demand करे कि मुझे antibiotics दें. Severe pain, toothache, periapical periodontitis or abscess, alveolar osteitis, dry socket, post-operative administration in an immunocompetent patient after multiple dental extractions. इस केस में भी आपने जो है antibiotic use नहीं करनी. Mild peritonitis हो, इतनी ज़्यादा ना हो, or drained abscesses limited to the alveolar process. Remember that. लेकिन अगर alveolar process से extend कर जाए, then you can use the antibiotic. So this was the sixth principle. So seventh principle is administer antibiotic properly. अब properly से मुराद ये है कि proper dose, timing and duration of administration of antibiotics. So हमने जो है proper dose देना है प्रॉपर टाइमिंग एंड प्रॉपर ड्यूरेशन के लिए देना होता है. ऑब्वियसली द डोज शुड नॉट बी वेरी लो, बिकॉज अगर हमने बहुत कम जो है डोज दे दिया, this will not be able to kill this will not be able to kill bacteria. Okay, and similarly जो है हमने overdose भी नहीं देना. Okay, so the goal is to achieve high enough plasma level to kill or halt bacteria that are sensitive to antibiotic while minimizing. Okay, तो गोल ये है कि हमने हाई इनफ प्लाज्मा लेवल जो है अचीव करनी है एंटीबायोटिक की, ताकि हम किल कर सकें या होल्ड कर सकें बैक्टीरिया की ग्रोथ को. ठीक हो गया. लेट्स नाउ टॉक अबाउट एट प्रिंसिपल. Evaluate patient frequently. Once appropriate surgical management, that is source control and drainage, with or without antibiotic therapy has been provided, patient must be carefully monitored for appropriate clinical response. अच्छा, उसके बाद आपने clinical response देखना होता है कि patient जो है appropriately response कर रहा है या नहीं कर रहा. In most cases of uncomplicated odontogenic infection in immunocompetent patient, uneventful healing occurs within a week. Typical follow-up is 2 days after surgical treatment. सही हो गया. मोस्ट केसेस में जो अनकॉम्प्लिकेटेड ओडोंटोजेनिक इन्फेक्शन होते हैं उनमें जो है 1 हफ्ते में ही हीलिंग हो जाती है. तो टिपिकल जो फॉलोअप होता है वो फॉलोअप पीरियड जो होता है वो 2 to 3 days होता है. अच्छा, अगर पेशेंट जो है वो has persistent swelling, pain, drainage and constitutional symptoms, the clinician should assess the cause of inadequate clinical response. अब यहाँ पर एक चीज़ बहुत इम्पॉर्टेंट है कि 2 से 3 डेज में हमें पता चल जाता है कि पेशेंट में जो स्वेलिंग, पेन, या फिर ड्रेनेज या जो कॉन्स्टिट्यूशनल सिम्टम्स है वो कम हुए हैं या परसिस्ट कर रहे हैं. अगर कम हो गए हैं दैट मीन्स इट इज़ अप्रोप्रिएट रिस्पांस. लेकिन अगर परसिस्ट कर रहे हैं देन हमने केयरफुली असेस करना है adequate clinical response. As a general rule, inadequate surgical treatment should be presumed the primary reason until proven otherwise. अच्छा, जनरल रूल ये है कि आपने सर्जिकल ट्रीटमेंट को ही inadequate समझना है. It can be source control or drainage or both. यानी कि when there is no clinical response, अगर response आपको नहीं मिल रहा तो आपने surgical treatment को ही inadequate समझना है. That can be source control or drainage or both. It can be a fragment of tooth that remains, और आपने drainage जो है वो properly जो है नहीं की. That can be the cause of inadequate clinical response, यानी कि surgical treatment का inadequate होना. Source control आपने inadequate किया या drainage आपने properly नहीं की या आपने दोनों ही inadequately perform किया. अच्छा, but if problem is not the surgical treatment, then another reason of inadequate response is compromised host defenses. Okay, so दूसरा काज ये है कि जो पेशेंट है वो compromised उसका host defense है. Maybe he is a diabetic patient or having other problems जो immune system को क्या कर देती हैं, डाउन कर देती हैं. ठीक हो गया. So you have to evaluate that. And the another reason of failure is problem with antibiotic administration. Either आपने जो dose है वो properly नहीं दिया, या आपने duration में जो है problem create की, or other reasons related to antibiotic administration. So This was the eighth principle: evaluate patient frequently.